This is going to be the most fun video about my residency so far, so let's get started. Hey guys, welcome back to the channel. In today's video, I want to talk about my life as an ophthalmology resident in the last couple of months. It was a very busy time for me, and I've basically worked around like 50 hours per week. And I've been working at all different departments of our clinic. So this includes the ward, the outpatient clinic, the functional diagnostics, and the Pediatric and Neuro-ophthalmology department. Besides that, I've also been able to learn a lot of different laser procedures. So in this video, I want to talk a bit more in detail about my experiences at the different departments. First of all, the ward. This is the place where I've been the most of the time in the last month. I've already made a video before about the tasks at the ward. Basically, we see all the inpatients there. That could be patients who had a surgery before, like a cataract surgery, vitrectomy, or trabeculotomy. And on the other side could also be patients without a surgery, like a patient with a keratitis. We also see the outpatients that were discharged maximum 2 weeks ago. And with all these patients, we ask them about their chief complaint and do a detailed physical examination, which includes the check of the visual acuity, the eye pressure, the anterior segment examination, and also a fundoscopy. After that, we present the patient to our attending and discuss with him or her the further diagnostics, sometimes even a diagnostic surgery necessary, and also the treatment plan. So what kind of prescriptions are necessary, and maybe even a surgery. Besides that, we also see the patients who are going to have a surgery the next day. In this case, the attending has to decide with us if it is really necessary and correct to do the surgery, and also if the eye is in a condition that allows the surgery. In the last couple of months, I became the chief resident at our ward, so therefore I had a lot of more responsibilities. So, for example, I would usually get the most difficult cases at the ward to take care of them. I would have to interact with all the nurses to make sure that all the diagnostics and treatments are going to happen like we planned it. And I also had to help my younger colleagues whenever they had a problem with like some physical examination of the patients or with medical reports, something like that. Furthermore, I also had to make sure that we would be on time and keep all the attendings updated about their own patients. Besides that, I also got a lot of calls from patients or other eye doctors and give them information about the diagnosis and treatments of their own or of their patient. Second, I also worked at the outpatient clinic a lot. Here, I've also been one of the more experienced residents. I was also taking care of most of the emergency patients. So during this time, I've seen a lot of different patients with diseases like retinal tear, retinal detachment, vitreous hemorrhage, central retinal vein occlusion, central retinal artery occlusion, arteriolytic and non-arteriolytic, anterior ischemic optic neuropathy, patients with glaucoma. Besides that, I've also seen a few patients with really rare diseases like choroidal bleeding, varicella zoster endophthalmitis, and also patient with Stickler syndrome. Third, there is the functional diagnostics department. This department I've been for around 6 months so far. It is a place that's really interesting and a lot of fun, and where I learned a lot of new things. So mostly we take care here of patients who have diseases like diabetic retinopathy, central retinal vein occlusion, age-related macular degeneration, macular pucker, Irvin-Guest syndrome, ischemic optic neuropathy, ocular ischemic syndrome, uveitis. Most of these patients need fluorescence angiography to find out the right diagnosis and figure out the right treatment options for them. So at this department, I really learned a lot, because before it was really difficult for me to figure out which disease it is and what treatment we need. Through this fluorescence angiography, I learned a lot of diagnostics of different diseases. So the fluorescence angiography allows to examine the blood circulation of the retina with a specialized camera. The fluorescence is injected in a vein and reaches the eye after around 10 to 15 seconds. And it causes the blood vessels to fluoresce, and this is recorded with a specialized camera. It helps to evaluate the vasculature of the retina and the optic disc, and also figure out the right diagnosis of the patient and also the right treatment, which could be surgery and or injection of an antivascular endothelial growth factor or steroids and or laser treatments. Fourth, the Pediatric and also Neuro-ophthalmology department. This is the place where I've only worked a few times so far. And here we treat patients with diseases like endocrine orbitopathy or optic neuritis, or patients with a pituitary tumor. Besides that, also all the patients under 18 years old are treated. The most common diseases in these patients are refractive errors. So patients would have myopia or hyperopia or astigmatism, and they would need glasses. Otherwise, these patients also often have strabism, and they need treatment, which includes surgery sometimes. And the treatment of these conditions is very crucial, because otherwise patients can develop a disease called amblyopia. This means that they have a decreased vision in an eye that appears to be normal in other aspects, but the problem is that the brain kind of does not get enough visual input from this eye, and therefore the development of this eye is reduced, and also the vision at the end. Other conditions that are often treated would be congenital glaucoma or retinopathy of prematurity. Finally, I was also able to learn a lot of different laser procedures. So first of all, the laser iridotomy. This is a procedure in which there's a hole created in the iris, and that allows the aqueous humor to float from the posterior to the anterior chamber. And this is, for example, an important treatment for a patient with a pupillary block. Furthermore, I was also able to learn the laser capsulotomy to treat patients with a posterior capsule opacification after a cataract surgery. Furthermore, I learned to do the laser retinopexy, a procedure to create a barricade scar tissue around the hole to avoid a complication like a retinal detachment. I also learned the panretinal photocoagulation. This treatment helps to treat retinal ischemia and retinal neovascularizations, mostly due to a proliferative diabetic retinopathy. And finally, I also learned the pattern scanning laser trabeculoplasty for reducing the intraocular pressure in a patient with an open-angle glaucoma.